name is Jessica, and this is Caitlin. I'm going to be performing a physical assessment. Caitlin, I'm going to be talking to the camera, as well as giving you instructions on what to do.
Okay.
I'm going to start with the head and move down to the chest, into the heart and lungs. Sounds okay? Of course, I would provide privacy and do hand hygiene. I'm going to be assessing facial symmetry and her skin for any lesions, abnormalities, dryness, moisture. I'm going to check her mood and affect, check her speech and hearing, try to talk at a normal tone, make sure she can hear me, check her level of consciousness and orientation. Caitlin, do you know where you're at today?
I do. I'm at the College of Nursing.
Okay. What day is it?
Today's Wednesday. Thursday.
Who is the president?
Obama.
Okay. We're going to go ahead and say she's oriented. Okay. I'm going to start by palpating your head, checking for any abnormalities, any lumps or bumps, any pain or tenderness. Do you have anything or tenderness? No. Okay. Checking again for facial symmetry. I'm going to feel for the sinuses, frontal, maxillary. I'm going to feel her temporal artery. It's strong. I'm going to check her temporal mandibular joint. So if you can just open your mouth, open and close. Check for any popping, any catching just fluid movement there. I think it is. I'm going to do a confrontation test. Just tell me whatever you can see my fingers in your peripheral vision, okay? Okay. Okay. I'm going to check your corneal light reflexes and all your external eye structures, your conjunctiva, cornea, sclera, and iris, and pupils. I'm going to have you just look at me, and I'm going to check your pupils dilating. I'm going to shine the light in her eyes. They should constrict when I shine the light, and they should dilate when I turn it off. And I shine it twice to look at the opposite eye, constricting with it. Okay. I'm going to check for accommodation. You can just look at the pen line. And then look at the wall. And look at the pen line again. Her pupils are constricting when she looks at the pen light, and they're dilating when she looks at the wall, and that is normal. I'm going to check the 6 cardinal positions of gaze. If you can just watch my finger. And at this time I would normally do a Snellen chart where she would stand 20 feet away, and she would read the lowest line that she could visibly see, covering one eye and then the other, and then not covering either one, and that would give us her visual acuity. Now I'm going to check your ears. First I'm checking just the external ear here, checking for any abnormalities, and I'm going to check inside your ear, the otoscope. Okay. I'm just checking the tympanic membrane here, making sure it is intact and not leaden. Okay. Now I'm going to do the whisper test. I'm going to whisper a word in her ear, and I'm going to have her repeat it for me.
Basketball. Football.
Now I'm going to check her nose, check for symmetry there, and I'm also going to check for any drainage or any abnormalities inside of her nose. Do you have any drainage in your nose?
No.
Okay. I'm going to check for patency. Can you breathe it? mucosa is normal, and her nose is patent. I'm going to check in her mouth for any lesions, any abnormalities there. Check her mucosa as well, and I'm going to check her tonsils and her gag reflex. I'm not going to gag you. Okay, can you say ah? Perfect. I'm going to check your neck for your lymph nodes, make sure there's no enlargement. I'm going to check your carotid pulse. I'm going to do this one at a time as to not obstruct any blood flow to the brain. Okay, maybe I'll face the camera. I'm going to check your trachea and thyroid. Check to make sure trachea is midline. And if you can swallow, I will check your thyroid. Okay. You should be able to feel her thyroid when she swallows to see if there's any nodules or enlargement. Okay, so now I'm going to move to your chest. When she's looking at me, I'm going to check her chest symmetry. Make sure when she's breathing in and out, it's rising and falling at the same rate. And check your breath sound. So every time I place my stethoscope, take a deep breath for me. Okay. I'm going to check her posterior breath sound. Okay, good. Just making sure her breath sounds were clear. Now we're going to do the bronchophony. Watch, I'm going to have her say 99 in each of the same spaces that I checked. In this test, we're listening for consolidation. When she says 99, it should be muffled. Every time I place my stethoscope, just say 99. 99. Okay, good. And then this next one is egophony. I'm going to have her say E every time I place my stethoscope. Again, checking for consolidation. E, 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 And one last test, it's a whisper test. I'm going to have her whisper 1, 2, 3, and I shouldn't be able to hear it much at all. It's going to be faint and muffled if I can. Okay, good. Now I'm going to check for tactile dermatitis. I'm going to feel for vibrations on her back. I want you to say blue moon anytime you feel my hand on your back, okay?
Okay. Blue moon. 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 Blue moon.
And we're only going to check a couple of spaces on her front, just because she's a female and the breast cheek gets in the way there.
Blue moon. Blue moon. Blue moon. Blue moon.
Okay. Now I'm going to percuss and see if I can hear any little resonance. Moving to the heart, the last part of the physical assessment. I'm going to also take all 4 valves, the atrial, the pulmonic, tricuspid, and mitral. Just breathe normal. And normally I would listen for the apical pulse for a full minute, but due to time, I'm going to skip that there. So I think this concludes the physical assessment.